So good morning, everybody. My name is Fraser Goodwin. I'm the Advocacy Coordinator here in the European Public Health Alliance in Brussels. And I'd like to warmly welcome you all to this webinar and hope that we can have a rather interactive short session. It is only an hour and a half, but we all encourage you participants to put questions to our presentations and make sure that we run a wonderful event. The event itself, the webinar, will be facilitated and moderated by Jack Hunter, and rather than go on at length, I'll pass the floor over to Jack to open the webinar. Jack, to you.
Thank you, Fraser. So yes, I'll be moderating. I am just to introduce myself a little bit, I'm a media relations specialist. I've been helping NGOs to get mainstream media coverage in Europe and beyond for about a decade now. You might see, for example, tomorrow there'll be a big story breaking on the climate impact of the war in Ukraine. And as it happens on Friday, there'll be a story, perhaps a little bit less visible, on gas cooking, as it happens, doing some analysis on the price of induction cookers coming right down in many countries. I am more of a media person than a host, so apologies if this is a bit not going super well, but I'll try my best. So before I introduce the speakers, just want to recap a little bit about why we're here. So this is a 90-minute session that aims to bring together healthcare professionals, researchers, and communication specialists. We really want to boost your capacity to campaign for clean cooking, ensuring that everybody understands the, I think, still surprising health threats from gas cooking. Specifically, we want to reach policymakers and the media. Of course, there's usually a very healthy overlap between those two audiences. Why now? IFA feels that the effective communication is very important right now because of the imminent start of a new European mandate, plus the ongoing revision of some influential legal frameworks, including eco-design and labeling regulations for cookers. I've actually happened to be working on these files for a number of years, and I know that they've got huge impact on consumer choice. But at the same time, they're very vulnerable to tabloid media attacks along the lines of there's a bureaucrat in your kitchen. So I'd be very interested to hear what the communication specialists feel about how to handle those things. I've got my own views too. We're going to get today some super interesting research in the first part of the session, followed by more of an advocacy feel to the advocacy and communication feel to the second part. These are going to be rapid fire presentations. So let me introduce the speakers. Firstly, Juana Maria Delgado is the principal investigator of the European Health Research Laboratory at the University Juan, how do I say that?
Jaume primero, Jaume the first.
It's a challenge. Going to cover the latest data on health and economic costs of gas cooking. We've got two speakers from Opinium, the market research and insight agency. Lorian Perryfrost is head of qualitative research, joined by Callum Weir, political research executive. They're going to look at the importance of framing following some message testing that IFA has commissioned or had commissioned. Then you'll hear again from IFA's Fraser Goodwin, who's going to be kicking off the second half of the training, looking at how to build, I think, an advocacy movement for clean cooking, and taking a look at some of the advocacy techniques we can use. And lastly, Carol Paula Witzer will join us from the, Carol is a strategic communications associate for GSCC, and he's going to be sharing some insights from Poland on media engagement strategies. So let's turn to the first session, 30-minute session on research and communications insights, with Juana kicking off. followed by Lorien and Callum. And then we'll have a brief Q&A where you can put your questions to them. So if we can please show Juana's slides.
Showing?
Yes, please. And then I'll hand over to Juana.
Okay, perfect. Okay, so we are going to be talking about the health and economic cost of gas cooking, the latest data that we have been working on. And the main objective of our research project is to assess the health impacts and also the cost that are associated with the levels of air pollutant observed indoors, in particular in those houses that use gas cooking appliances for cooking in both all the European countries and also in the United Kingdom. And what we are going to be testing is what would be the benefit in terms of the health impact and also the valuable economic reduction associated with several policy recommendations. So what we are calculating really is the population attributable fraction. What does it mean? For instance, if in a year in a country we have 1 million hospitalizations due to respiratory disease, how many of those hospitalizations are due to exposure to gas cooking fumes? So this is what we are calculating. For that, we need information on what is the population that is exposed to this risk factor, in this case, gas cooking. And also we need information from the literature that tell us for each increment or decrement of the concentrations of a particular pollutant, what will be the increment or decrement on the health outcome that we are interested. For instance, mortality, premature mortality, or hospital admissions. So this is the information that we are gathering across Europe and the European and the United Kingdom, and also information from scientific literature. So the first objective really is to determine the burden related to mortality. And here we are calculating both the years of life lost due to exposure to gas cooking emissions and also premature mortality. So the information that we first need to consider is what is the concentrations of NO2. We are focusing on NO2 that are we breathing in the houses that use gas cooking versus the houses that use other cleaner fuels, like, for instance, electric cooking. For doing that calculation, what we are using is information that has been gathered through a TNO report that has been measuring concentrations on houses that use gas cooking and electric cooking across 7 countries, including the United Kingdom. And so that information is from directly measuring the houses, but we also have information that the European Union is measuring in the streets in our cities to control the concentrations of harmful pollutants. So by knowing the concentrations outdoors and also knowing the concentrations on the houses that cook with gas hobs or with electric hobs, we are able to calculate an indoor to outdoor ratio of our pollutant of interest, NO2. And then with that indoor-outdoor ratio, we are able to escalate to the whole of Europe to know what would be a house in a specific location that was cooking with gas hobs, the concentrations of NO2 in their houses, and also if they wouldn't cook. So, for instance, what is interesting, there are some hotspots of outdoor air that we know that definitely are higher in some parts of Europe. And in those places, we would expect also to have higher concentrations, not only if they are cooking with gas, but also because outdoors you have higher concentrations. And this is what we see here. So in this map, what we are showing is the concentrations expected in houses that would cook with gas cookers versus the concentrations that would be expected in houses that use electric cookers. The image seems very much the same because you have to consider the outdoor air, but however, we have to take into account that the gas cooker houses will have higher concentrations. For instance, the country average will be 2 to 16 micrograms per cubic meter versus the same country average if the houses were cooking with electric hobs. The next bit of information that we need is the risk of mortality, and that has been reviewed in the literature. We are using established risk of mortality ratios for chronic mortality, years of life lost, and also premature deaths. And we also need information on what is the average years of life lost across Europe, and also the premature mortality. So when we calculate what would be like if you were cooking with gas, the country average will be that we will save around 16,000 years of life lost in the biggest hit country, which would be Poland and Italy. And that will represent around 1.6% of the total mortality in the countries. We also see from these maps which are the countries that are more affected versus the countries that are less affected, and the countries that are less affected is because they are already cooking with clean energy with clean energy cookers. This is for the premature mortality. So we observe that around 13,000 premature deaths could be saved, for instance, in Italy, versus little premature deaths that could be saved in Finland, because most of the houses cook with electric with electric cookers. The next thing that we are calculating is hospital admissions due to respiratory disease. So the information that we need to include into our calculations is the normal hospital admissions per country per disease, and we focus on respiratory diseases, and then which is the risk ratio associated with respiratory hospital admissions when you are breathing NO2 concentrations. And that is also available in the literature. So the information that we gather then is, again, what is the country average? So it can range from 3 to 340,000 respiratory hospital admissions due to breathing NO2 from gas cookers. And this represents around from 0 to 1%, 1.6% of the respiratory hospital discharges attributed to gas cookers. The next health outcome that we were interested in was pediatric asthma, and what is the cost of the medicines and interventions going to hospital admissions, etc., associated with asthma. So the information that we have considered is this risk ratio, or the odds ratio of having a prevalence of asthma in childhood per each of the micrograms per cubic meter of NO2, and also information of childhood asthma prevalence across the countries of interest. And in here we have, which is the childhood asthma prevalence due to gas cooking. We observe that the most heated country in this case would be United Kingdom. And depending on the country, you might have up to 16,000 childhood asthma cases. So if we put here the top 5 countries, we identify that most of them are the same. So it's United Kingdom, France, Romania, Poland, and Italy, the ones that would benefit from switching from the gas cookers that they normally use to cleaner electric cookers that are not emitting NO2 concentrations. The next thing that we have done, it was calculating the economic value associated with that premature mortality, with the respiratory hospital admissions, and also with the childhood prevalence, taking into account the value of statistical life, the value of a life year that you are losing, and also the cost of the hospital admissions that it's published. We also consider the inflation, because those values were calculated back in 2012, and also the differences between the GDP in the different countries. So overall, we have calculated that there are around 39,000 premature deaths across Europe and the European Union and UK, which represents 160 billion euros lost. In terms of years of life loss is around 70,000, which represents 14 billion euros lost. As regards respiratory hospital admissions, we have across the European Union and United Kingdom 1 million, which represents 6.5 billion euros that have been lost due to gas cooking, and also 40,000 children suffer asthma linked with gas cooking emissions across the European Union and the United Kingdom, which represents around 4,000 DALYs, and also 735 million euros lost. So the health impact associated with gas cooking has been assessed, and we know now more information about the number of premature deaths, the years of life loss, the respiratory hospital admissions, and the prevalence of children that are suffering asthma due to gas cooking emissions. We have also put a value on the economic cost that this represents for the European Union and UK, and this is around 181 billion, and this will be mounting because we are also calculating other health outcomes. And we have identified which are the top countries that would benefit from switching to cleaner cooking appliances, and those will be United Kingdom, France, Italy, Poland, and Romania. And this is because those are also the countries that use more prevalent gas cooking. So I would like to thank my collaborators that have been working into doing these calculations, and I thank you very much.
Thank you very much. Okay, let's hand on now across to Lorianne Pennyfrost and Callum Weir from Opinion for a session on the importance of framing. Could we have their slides, please? Okay, over to you guys.
Perfect. Thank you very much. And I think we can skip on to the next one. Thanks, Jack, for that intro. So yes, my name is Lorianne Pennyfrost and I head up our qualitative offer at Opinion, and Callum is a political researcher at Opinion, taking a step back from the polling today to be with us this morning. So today we'll be talking through the importance of message framing and hopefully sharing with you some actionable insights to take forward into your own work. Our research is very much focused on message framing, message testing with it to consumers, so kind of your Joe blogs on the street.
Yeah, if we can just move on, please. So we felt like in order to get the messaging right, we have to tell basically a small story. So the first thing here is cause and giving people a reason to care, and as well as that, giving people an appetite for motivation. So in this instance, obviously, that would be the health implications of gas cooking. Then just making sure that there's a basis in facts and in evidence, and this makes sure that there's no room for any doubt as to the aims of the message, and that there's no sort of wiggle room for, as I think was discussed earlier, basically tabloid attacks and things like that. As well as that, and building on that, choosing spokespeople that are very trusted and respected backs those facts up further. And then finally, building on all of this, just having an ultimate call to action is important just to get people to make that change. If we could move on, please. Thank you. So then we wanted just to delve in a little bit what the barriers were currently to this. So we found that across all three markets that we tested, so this is Italy, Spain, and Poland, that there were barriers to switching from cooking on gas to cooking on electrical, were mainly financial. And this is both to do with increased energy bills, as you can see there, but also the high purchase cost of electric appliances. Essentially, people don't switch if they feel like it's too expensive. So what do we do here? Well, as you can see, that 2/5 already think that gas creates indoor air pollution. So this creates a good opening for where we can hit messaging to make it a more rational decision. Indeed, we can build on that further and add an emotional element, and this would be highlighting how this negatively affects children's health in particular. We found that when we dug down even further into the data, that communications that highlight the link between asthma and other breathing diseases are particularly effective, and the symptoms and the link between these two are very easily understood for audiences. And that's, as you may imagine, particularly effective when targeting parents and grandparents. You'd be talking about the impact on children being particularly effective because it's protecting their loved ones, obviously.
Thank you. So the second principle is about the tone in which messages are delivered and the overall delivery. So what we saw quite clearly from the research, the qualitative and the quantitative, is that people don't want to feel like they've been preached to. Rather, they want to feel like they've been given the facts and that they have then drawn their own conclusions from the information that they've been given. Stats work well because in the main, they're seen to be quite neutral data, and stats are also really good at communicating scale. So if we have a look at that quote at the bottom that came from our focus group in Spain, they've got the emotional hook of our message talking about the fact that it impacts many children, but also then the fact that it's like 700,000 is like, wow, actually that packs a bit of a punch. Now you're giving me some numbers. But we are emotional beings, so emotional hooks do work to a certain extent. And as Callum mentioned previously, referencing children is powerful in kind of hooking that engagement, hooking that interest, making people feel like, okay, we do need to make a change here. But messages can't be too negative or overly sensationalized, because then they have a tendency to turn people off. And what we did find was that messages that kind of referenced early death can sometimes be a little bit hard hitting for your general person on the street. They're more likely to label those types of messages as being alarmist.
Yep. So just moving on. On that point, then, who do we want to deliver these messages? So I think earlier I was saying about making sure that we choose our spokespeople wisely. And when we look at who people want to hear from, I think there's quite a clear distinction here. So as we can see in the top, on basically across all three of the countries that we surveyed, the biggest one that people want to hear from are either researchers or doctors. So having that sort of facts and figures approach, as Lauren was talking about before, actually it probably fits quite well to have these spokespeople talk about that, because it gets a really good sense of authority behind that. When we look at who people want to hear from least, it tends to be people that the public might imagine have a vested interest. So in particular, we see national governments. I think in Italy, we see the EU, and in Spain and Poland, we see appliance manufacturers. Obviously, they would be seen as having a vested interest as well. So it's just making sure that there's a neutral and authoritative party that are giving these messages. That's what would really set a message apart and get it to cut through.
Thank you. And then our final kind of takeaway from our principles of message framing then are that messages need to be understood and they need to empower action. So we are dealing with quite complex and technical ideas for the average person on the street. So it's important that the takeaway messages are landing with a kind of general audience. People do struggle with abstract concepts, but what we saw was that when messages kind of drew comparisons to ideas that were already understood, such as talking about harms created by cigarette smoke, it landed much better. People could understand the track that that the messages were on. But messages also need to make people feel like they can make a difference. They need to still an sense of hope in order to kind of galvanize that action and support. So we found that messages that discussed indoor pollution levels being higher than outdoor pollution levels, they were powerful in capturing attention, like it was interesting education for the general reader. But we also found that people kind of were quick to rationalize why that might be the case. And there are lots of different solutions. Oh, well, there's electric vehicles coming out. And it was easy for them to give away that personal accountability and responsibility to support change. And what we also saw were when messages focused on kind of socioeconomic factors, again, they were powerful in creating that sense of it not being right, and in highlighting the differences between groups of people. But we also saw that people were more likely to label messages as being stigmatizing and helpless. So again, perhaps not the best angle if we want people to actually take an action and make them feel like there's a way to change the trajectory that we're on. And that's our slides.
Thank you very much, both of you. We've now got time for a Q&A, a little bit under 10 minutes. So unfortunately, Juana Maria has had to leave early, so I'm afraid we won't get to put any questions you have to her. But if anyone has any queries for the opinion team, please speak up now. I see a chat message. Oh, that's from Juana Maria. Please don't be shy, just turn on your mics and maybe introduce yourself and put your question if you have one. If not, I've got one. You know, you mentioned about cost being a huge factor to overcome. I mean, it's so often the case, isn't it? You know, we hear all the time, I'm sure, in all countries that, you know, the economy is vital. I'm sure during this election period, we heard journalists saying, you know, banging on about the economy, even when it comes at the cost of quality of life, or even actual life. So I wondered, you were saying that health is an important factor in this. Does it trump cost? Do you find that, you know, you do get through? I don't know if your research would be able to answer this question, but can we overcome that cost consideration when health is at play?
Well, I think you're ultimately balancing two things that people will look at quite rationally, to be honest. Though obviously health is going to have its own emotional angle, as well as the economy, actually, frankly. But they mostly will be dealing with these quite rationally. So you are pitting two things up against each other that hopefully are at least comparable. It's very hard to say whether one is more important than the other to people. It depends, I think, a little bit on circumstances. So, for instance, politically, that we may see that the economy is seen as very important, but in people's consumer choices, that actually health can sometimes be more important. I think it. For this purpose, I think we found that at least that health gave us a really good in, frankly, to make that case, and that the barriers could be. It would obviously that a little bit because you're asking people to balance between two things that are obviously very important to them. So I suppose in the round, the thing is that both things are incredibly important to people, is our findings generally. So and one tends to work in the favor of the messaging here. So it's the one that is probably best to focus on.
Thank you, Callum. Does anyone else have anything to raise? Any questions? I see an anonymous attendee. Let me read their question. Could you elaborate a bit more on the part of your research that showed that some people are hesitant to switch to clean cooking because they prefer gas cooking? Is this a difficult preconception to challenge?
Yeah, so I think you're possibly referring to one of the slides previously. So sort of wedge between increased energy bills and high purchase cost of electric appliances. That is one of the big factors, as well as just being used to cooking on gas. Um, we've it's a very tough one. You're both, I think, dealing with again that there is actually a cost implication there as well, but there's also sort of a food, just a tradition implication too. But we actually found that, quite surprisingly, that this was quite flat between the markets at the very least. So we would maybe expect that Italy, which we found had a really high level of gas cooking, wasn't much more likely to say that this was a big factor for them than, say, Poland or Spain. So it's not. It's that it is important, but actually, it's possibly not what's driving people to hold on so much. Because if it was, then that wouldn't have already shifted. If you see what I mean.
Yeah, maybe I could add a bit of nuance from the qualitative discussions that we had as well. So we did have people saying things like, well, I prefer cooking on gas. The food tastes better, or it's easier to maintain that oven because, ceramic tops break easily. So things like that. But I think what is powerful and therefore is the good leverage is that health implication, but then this understanding that, well, actually cooking on gas is dangerous. So that's we're not starting from scratch with telling people that it's not a safe option, both from the kind of pollutant level perspective that is on the radar, but cooking on gas is also seen to be dangerous because of high risk of explosions. So it's a good foundation to build off of, even if people do think their food tastes better when cooked on gas.
Any more queries from the floor? Yes. Okay, this is Thomas de Jong. With current concerns of increased energy poverty, I suppose you could argue that a switch to clean cooking is especially crucial now. In your experience, do policymakers take this into account enough? I'm not sure that's going to come out in your research, right? Because you didn't query policymakers, but
Yeah, sorry, Thomas. Not particularly. I think the only thing I would say there is that, in terms of policymakers, I just refer you back actually to the finding that we found about messaging and who's delivering messages. So, frankly, when we put politicians to do some of the messaging of this, it actually tends to have less of when people want to hear from them the least on this issue, basically. So, so I get your point is that then it's ultimately about the outcomes. But from our point of view for the messaging, and in making that call, making that pitch, we probably want to hear from them less than more, and that we found that obviously people like researchers, doctors, and that were much more the people that people wanted to hear from.
thanks, Callum. I think we're about out of time for the Q&A now, so let me pass on now, turning from research to advocacy. We're going to open a 50-minute, this final session, 50-minute session, kicking off now with Fraser again, who you heard from briefly at the beginning, followed by Carol from GSCC, and concluding again with another Q&A, if there's time. So Fraser's slides, if we could get those on screen. I'm not sure if you're presenting them, Fraser, but if we could have those up on screen, I can hand over to you. And Fraser's going to be covering why we need a movement for clean cooking, followed by a sort of separate section on an overview of advocacy techniques. To you, Fraser.
Great, thank you very much, Jack. So just as a shorter introduction to who I am and what my background is, I'm the advocacy coordinator here at EFA, and I've had 30 years experience of EU policymaking, dealing with all sorts of issues that are directly related to this type of issue on both air quality, emissions, different technologies, fuels, and the environmental impacts of, in particular, transport sector, but also broadly of air pollution. So if I could start with my first slide. One of the things I wanted to look into is if there is a campaign, a model that we can base our own work upon, look back and see if there was a campaign that gives us a lesson on how you construct a movement that would be for a specific technology fuel switch on health and environmental grounds. And lo and behold, there is an absolute model campaign to follow that is cited as a model campaign on both health campaigning and on environmental campaigning and on fuel campaigning. So that is, if you press the button, the campaign for lead-free air. This is the campaign in the UK. There were other campaigns similar to this in other countries. I don't want to bang the drum for just the UK, but this was a very, very clear campaign in both its name and its objectives. And it's now cited as an example of how you go away and do a campaign on environmental grounds or on health grounds or on transport grounds. So, and the fact that it was fundamentally targeting fuel switching and changing a fuel for a specific technology really means that it gives us plenty of things to work on. Now, the next slide. For those of you who were too young to know, we used to add lead to petrol. Quite amazing that we'd add a known toxic, something that we've known to be toxic since the Romans, in a form that we knew would be combusted and released in a breathable form out of the exhaust. And we did it for decades and drove billions of kilometers in total with this added lead to our petrol. there is measurable impacts on US IQ for cohorts who are exposed to this as children. So it's remarkable that a campaign was actually needed, that we actually did this in the first place, but we did. This was what a petrol pump used to look like, 4-star leaded petrol in the UK. No other options. You could have different types of octane rating in the fuel. So you could have 2-star, 3-star, 4-star, depending on the sort of car you had and whether or not that car would run on those types of fuels. But they were all leaded apart from diesel. So that was the reason for the campaign. So next slide. This is the wiki page of the campaign, which outlines the first of all what went into the campaign. So there was a widespread realization by many people that it was really not very sensible to add lead to petrol, and not only was it not a direct problem as a toxic in itself, it also hampered emissions control technology because it killed the catalytic converter. So you couldn't have a 3-way catalytic converter with leaded petrol. So if you wanted to really do anything to improve emissions control from road transport, then you needed to stop adding lead to petrol. So the campaign was started. Interestingly enough, it was facilitated and enabled by private finance, by a philanthropic donation from a wealthy individual, and it harnessed both advocacy, campaign experts, and also medical and research communities. And it was so successful that it only in a couple of years enabled the Royal Commission on Environmental Pollution to publish a report upon it, which half an hour later changed government policy. So obviously that speed of impact has not happened by accident. All of those things have fallen into place because of the campaign structure, the campaign organization, the campaign outreach, and actually building a movement, not just the campaign. And that's the point I really want to draw upon, and the lessons that we need to learn. Next slide, please. So what happened after that government policy change? Well, implementation is always the thorny issue. Once you've changed the policy, making sure that policy has impact and that impact is maximized, then took a number of years. The offer of making sure unleaded petrol was available at the pump, the marketing of that to make it desirable or something that consumers wanted was also necessary and key, and that took about 10 years. But as a result, the whole campaign is seen as a textbook example of how you do something like this. And next slide, the result of that was, this is the petrol pump that at the end of the campaign rather than the petrol pump at the beginning of the campaign. You have a more modern looking pump, obviously, but also you had both the 4-star, the leaded petrol and the unleaded petrol available, both at the same octane rating as well as diesel being offered. And so it then took a further 10 years or so before the sale of leaded petrol overall was banned. And that was on the basis of a European directive, the first actual directive for fuel quality that was passed by the European Union. One of the problems with unleaded petrol when it was first put on the market was consumers, you could smell a difference. It really did smell differently. It smelled sort of nutty and aromatic. The reason being 5% of it was benzene. So you're swapping one health risk for another health risk, which was not particularly useful. And so the European directive that banned leaded petrol also contained fuel parameters which reduced total aromatics and benzene content in fuels, so that health issue was also addressed. So overall, the campaign and the movement that was built didn't just improve the health and environmental impact related to the specific campaign, it did a bigger job as well, and it also allowed better emissions control technologies to be regulated and enforced. So when that directive was proposed, it was proposed with a package of measures which were also the emission standards for light duty vans and for cars. So the actual technology that the unleaded petrol enabled was also then required at the same time. So a textbook example of impact and achievement for a campaign. Next slide. What are the lessons? Well, one of the principal lessons is that you need a coalition. You need science, you need advocates, you need media, you need politicians across political spectrum if you're going to get immediate success and immediate traction. And then each type of actor in this movement has a different role and a different voice. It's not necessary that everybody speaks the same, as long as they all speak differently but support the main message. And then to echo what has just come on message framing, evidence and emotion were both needed, as were a narrative. It wasn't just a presentation of dry data. It wasn't just a motive pulling on heartstrings. Look, we're killing kids. It wasn't without the narrative. Look, this is how we change. This is what you can change. This is the impact on people driving ordinary cars. This needed all of those elements together if the campaign was to actually be functional. Next slide, please. And then another couple of points was that even though there was a specific organization, CLEAR, the Campaign for Lead-Free Air, even though that was created specifically and formally, it wasn't necessary for all of those actors to actually join the campaign and be seen as part of that campaign. In fact, it was really important that people were seen to respond to the campaign from their different perspectives rather than be a part of it. They could still be part of the movement, therefore. They could still ensure that the objectives were achieved, but they didn't necessarily need to be formally part of that campaign. And it was especially true for the industry, the media, and the political decision makers to be outside of that campaign, to be seen as responding to the messages, to the science, to the story, to the narrative, rather than being part of that campaign itself. So, next slide. The other thing that was notable is that although national progress was possible as a result of the campaign, and unleaded petrol was quickly being required as offered to sale in the UK, and that cars had to use it. It was only really after a longer period that you got more effective regulation. The ban on leaded petrol only happened because of a European initiative rather than national initiative. But that European initiative, that European action, was only possible because of progress at member state level. So it wasn't just in the UK, as I said, it was also in other member states at the time. Particularly Germany was very, very important, but also progress across the entire EU at the time. So there was a push for the EU to do something because it required a directive for real progress to happen and a ban to be put in place, particularly as this was a single market issue. So one country couldn't ban something that other countries wanted to sell. So it required member states to be demanding that Europe take action. So that's a lesson, as a sort of an analysis of what happened with the campaign is really clear. But what specifically does that then tell us about what we need to do on clean cooking? Next slide, please. So I think the first thing is that we need to continue to build a coalition build that coalition of science, of advocates, of professionals in the medical profession, or allies in the medical and the research community, as well as building across coalitions of advocates and working closely with media and politicians across parties to promote the need for clean cooking, and ultimately the end goal being a ban of new gas cooking appliances for sale. So this coalition needs action to be taken now to support and build the work that we've done already is a great starting point, but we need to ramp this up. And then each type of actor in this movement has a different role and a different voice, and we need to appreciate that we can't have a one role fits all. That different players will have different voices, even if they are echoing a very, very similar message. The other thing to note is that campaigning and advocacy have changed and evolved a lot over the time since the Clear campaign. Whilst I was preparing the slides for this presentation, I did some Googling. I also did some digging. All the materials I had in my archives on my top floor. Couldn't find my degree dissertation was on this topic in 1990. Couldn't find that, so never mind. But nevertheless, you can't Google for the campaign logo. The campaign didn't have a logo, and the idea of you having a campaign without a visual identity now is strange in the extreme, bizarre. So the way in which a campaign needs to have both a visual identity, a strong brand, and also produce materials and messages in a very, very concerted manner, it completely different to the sort of the insider lobbying in corridors and the meeting in social circles of the media people that happened in the 1980s. So we need to extract from the Clear campaign what we can, but also update it and apply a modern campaign framework, because without that, then we're not going to be able to extract what could be potentially useful. Next slide. And it really, I can't believe that I wrote all of this first line before having seen our last presentation, because the evidence and the motion are both needed, and as is a narrative. That is the main thing that we really need if we're going to have traction, if we're going to actually persuade people. That both evidence and emotion are necessary, and that I couldn't have come up with a shorter précis of the framing presentation we've just had. And then even if a specific clean cooking organization is created, and we've begun that type of work, and the campaign we have has a brand, has an identity, it's not necessary for all actors within the space to formally join. We've seen how in the framing presentation previously, it might actually be counterproductive if others, such as the industry and certain government or political decision makers, formally join the campaign. That might actually undermine our work rather than strengthen our work. So it's really clear that we need to build a movement, and that movement be more than the specific campaigning and advocacy that we do collectively. And then finally, I think the important point to draw on all of this is that EU action is possible, especially if it's built upon progress seen at national level, and that it requires that national action to spur member states to demand European-wide regulation or activity or policy making. And for that, we're going to be needing not just people in government, but parliamentarians as total legislators, and especially members of the European Parliament, legislators at a European level, they're particularly good at demanding action at an EU level because they have no role in actually initiating legislation themselves. So they have no responsibility for doing that, but plenty of ability to make noise and demand things from the European Commission. But member states are who the Commission really listen to. If member state governments start to specifically call for this to be included in Commission work plans, then that's when they are in fact wrapped into the work plan of the European Commission. And that's all I have. Thank you very much for listening, and I look forward to any questions you might have for me.
Thank you, Fraser. So we've had a couple of questions come through. First is from Armando Ruiz from the Spanish Federation of Associations of Allergy Patients and Respiratory Diseases. He's congratulating, I don't know who he's congratulating, but on the work, maybe in general, and asking, I don't see to who this is asking, how do you know if it's a specific topic has the potential to create a movement or impact and change? Because as has been explained, it takes a lot of time, years of work. Maybe that's one to Fraser.
Yeah, I think that the question is very good. How do you identify which topic is suitable to build a movement? I think that the model that I presented on the campaign for lead-free air really shows that this is a topic that fits that model, that approach. That there is a great scientific understanding of that there is a problem. There is an answer ready to go. There is a solution ready to go. There is then the persuasion needed to make sure that people understand the problem, understand that there is a solution, and then the link between that and creating a wider movement across not just advocacy and campaigners or researchers, but also wider supporters, both within politics or within, in this topic, it would be the foodies. So getting chefs, getting endorsement from people in the cooking space to say this change is necessary. Getting Jamie Oliver to say I've switched to induction. That type of endorsement as well. Creating a wider movement. This topic fits that model, that approach, and I think that. There's no reason why it can't. And you're right, it does take time to build that movement, but we're not starting from scratch. We're not starting from zero. We're starting from quite an advanced position. So we're not going to be inventing the wheel. There's a lot of material that's already out there. It's a question of building the coalitions and the persuading people who are outside our current orbit to come in and join us. I think that's the most important part.
Fraser, I've got a related question. You took us back to the lead in petrol campaign. We now live in an age of culture wars. We've seen that research showing the harm of cooking gets picked up and used in that context. Does that change any of your advice, the fact that we're dealing with, it being a culture war issue?
In a way, yes. It's how you frame the message, making sure that the campaign you create sticks to facts, things that, as many people have presented, we shouldn't be preaching. We should be advising and supporting and providing information. In that way, we can sidestep the criticisms that will come in the culture war environment. One of the things that happened as a byproduct of the Clear campaign was that unleaded petrol was sold as a marker for a green lifestyle. Now, if you want to be green, you don't buy a big car that drives unleaded petrol and buy loads of unleaded petrol. You buy a bike and a bus pass. So you really need to be careful how far down one particular path you go with messaging and with claims. And I think as long as you stick to the science, as long as you stick to the evidence, and as long as you provide a message framework that is not preaching but supporting choice, then you're going to get progress. And you will inevitably, as Carol has just been explaining, fall victim to the culture war, even if it's indirectly. Finding it difficult to gain access to platforms, for example, is a product of the impact across the board that this febrile culture war environment has created. But I know you're thinking of things like ULEZ, ultra low emission zones in London, and how politicized that got very, very quickly, or the 15-minute city concept, and how that's seen as you're demanding I live within 15 minutes. And as long as you frame it as choice, as empowering, rather than dictatorial and preaching, then I think that you can dodge a lot of that problem.
Maybe also who does the speaking as opinion.
Yes, exactly. Yeah.
There's a final question. We've got about a minute left if we just stick strictly to time, to Carol, wondering about energy security. I think, does the current context around gas imports, the dependency on foreign sources, also play a role in advocacy or discussions you've had around moving away from gas cooking? But anyway, I think that's all we've got time for. So
can I just add as well? I think that you don't need to say it. People will join those dots themselves. There's enough being said about energy security for people to make that link without you needing to actually jump on that train, as it were. So I think Carol's absolutely bang on here. Let others make that linkage, and we don't need to necessarily make those claims or that framing ourselves.
Well, why don't you carry on, Fraser? Because I think we're done. It's time for you to, I think, wrap up the session. Thank you from my part to everyone, and I'll sign off.
Yeah, thank you. So I have nothing really to formally conclude the session. I find it very difficult to play that role in this type of situation. But what I think I don't really need to even say is how mutually supported all of our interventions were throughout this session. That all of the things that we independently came to contribute were actually very, very, very well aligned. And it may look as though we've spent months talking to each other, planning this, but it's not the case. The fact is that what we know independently and individually, we've arrived at individually and independently, but we found the same things out, and the messages are very mutually supportive, and saying the same thing but from slightly different perspectives, in slightly different contexts, in slightly different directions. But that itself speaks to the space that's available to create a coherent movement, because follow what all of the presenters have said, and a movement will emerge. So I want to thank all of the partners for this project, because without a partnership, such a project can't actually get off the ground, and we can't deliver such a webinar. Partners at national levels are in Italy, the International Society of the Doctors of the Environment Italy, in Poland, a long-standing member, PTPZ, I can say that correctly, based at the University of Gdansk. And in Spain, FENAR, the Federation of Associations of Allergy Patients and Respiratory Diseases. So we thank them. And then finally, we've got a partner in CLASP, research project. So I'd like to thank all of those, but also I'd like to thank the team here at EFA that have helped put on this webinar. We can't see just the little orange man in a circle. We can't see Rebecca behind the little orange man. So we'd like to say thank you to Rebecca. But also we have Isla and Bridget who are online with us, and they've been helping disseminate our dialogue and our discussions and our conclusions to social media live as we've been talking. So I'd like to thank them. I'd also like to thank, obviously, the funders for this project, because without our funding partners, this type of activity couldn't happen, and that's the ECF. So I thank them from the bottom of our heart. And then, of course, the speakers. I thank all of you for bringing your contributions, your time, your energy, your resources, and your learning to a wider audience. And then, of course, Jack for ably steering us through the morning session. But there's one person who isn't with us, who I really wanted to make sure that I gave a thank you to, and that's the person who's put all of this together in the EFA team, Sarah Bertucci, who unfortunately has a health problem at the moment, which is why she's absent from our session today. It would have been her doing my intro and outro work had she been here, and it's her work that's created this coalition. And before her, as someone who put a lot of the partnerships and coalitions together, was Christina, so who no longer works with EFA. So all of those contributions together have enabled us to provide you all with a hopefully useful webinar, and something that we can all take and use and build upon as we go forward. And with that, I'd like to thank you all very, very much for joining us.
Thank you.
And goodbye, and have a good rest of the day and the rest of the week.
Thank you.
Bye. Thank you.